Good evening, everyone. About my background, which most of the thing covers what the work which I've done in telehealth from last 18 years. So later on, I'll take you what currently we are doing, and also with the engagement with the what are the things we are bringing in AI&ML in our project. So we should take us in anywhere between 15 to 20 minutes, and also I'll also talk about the future perspective for students in case they want to pursue their career with startup or if they want to work in any other organization. What are the things they can try to do? So that probably I'll try to cover that in the. So let me start with my background from last 18 years. What I did in the field of healthcare. So I started my career with a based company called Neurosynaptic Communications. It is a IIT backed up company, IIT Chennai backed up company. We used to work in rural health sector, bringing rural patient interaction with the doctors across basically from primary healthcare to tertiary healthcare services. So during this time, again, that is first time in India in that point in time where you can have the data transmit from under only 64 kilobits, which is developed jointly with the IIT Chennai. So I had got an opportunity to spend some good time in the IIT Chennai with all the professors. And later we have taken that project into across pan-India level, where we also partnered with organization called WHP, World Health Partners, which is currently running one of the largest telehealth clinic across India. Mainly their focus now towards the UP and Bihar. They are running clinics like 400 plus clinic called Sky Health Care Centers. So I was there as a part of the program for initial 25 setup as a part of the project. This is where I worked for around 4 years and learned some great opportunity to travel across India to meet all the healthcare service providers in terms of ANMs, nursing students who used to come for PSC, Physical Primary Healthcare Center, and how we try to educate them to use the medical devices. That point in time, Neurosynaptic has developed a product called Remedy, Remote Medical Diagnostic Kit, where it used to transmit around 5 parameters, which includes your the blood pressure, then spirometry, then ECG, plus also with the heartbeat sound. Where even at the 60-bit kilobits, where doctor from other side can used to hear that heartbeats of the patient. That was the innovative technology in the year of 2006 to 8 I'm talking about. So which has got a good thing. Even at the lower bandwidth, we could able to probably give the healthcare service to health provider. Of course, technically it is proved, but commercially in India, you all know telehealth still to prove themselves in commercial. But of course, teleradiology and telecardiology are the two things where I can see that then some success in the business models, but rest others think as of now. But last 3 years it is picked up, but yeah, generally you see overall picture is yet to pick up actually. So now after that I moved on to Mistros Medline Systems Limited. It's basically Indian based, Indian Bombay based company, where for the first time in India again, we have introduced called telecardiology unit, which is called mobile ECG device, where in partnership with Research in Motion, which is basically BlackBerry, you can use to transmit your ECGs, 12 lead ECG or a GSM SIM card with using a small data to the cardiologist. So in case that basically the use cases was when you're in a village and there is a difference between a healthcare providers, MBBS doctors, and also a cardiologist, right? So there are not much MBBS graduates used to read ECGs that point in time. So this is a project done to enhance the healthcare services and also provide the maximum output to the end users. In terms of cardiology is one of the major things. If somebody is in like some heart attack kind of thing, it's a very critical care thing. So we could able to transmit that data over GSM. It is also commercially like semi-commercial successful, where we had good units sold, as well as that application used across multiple places. It is used in PHCs, it is used in ICUs in hospitals, it was used in ambulances. So most of the places it is got used. And for the same award, we also received one of the award from Asia Pacific from Fast and Suleiman for the best mobile ECG unit for South Asia specific, basically. So I also spent some good time in like 2010 to 12 on learning on how we can enable EICCU model, basically connecting the doctors with the patient like 24/7 with their ICU patients. That means there are like 10, 12 beds in an ICU, and doctor has to go and monitor for each and every, or nurse can have to go and monitor, where nurse sitting on the station can monitor, can change the prescription, doctor can modify the prescription. Accordingly, nurse can able to give the thing, which is I'm talking about 15 years back. That time it was very new technology in India. And being an Indian company, we could able to do some proof of concepts and could able to implement in a couple of hospital. However, again, commercially did not much, not so successful. But nevertheless, in technology part, there are some data issues which is later identified. So that project is still on. A couple of companies are actually taken that thing and moving them forward. So after that, then I moved to Rico Innovation, which is a Japanese-based company, where we have worked on telehealth, basically bringing into two places. One is on the bringing telehealth to corporate companies, where if you see the large companies, for example, if you take as a Cognizant, if you take as Infosys, or if you take as a TCS, so they have something called OIC centers, which is called occupational health centers, where the employees goes and take the first kind of consultation from the nurse. In case if the doctor required, they will take it. So in these cases, what used to happen is it's all manual done earlier. Even the data which they collect is all manual. So we have brought in some, the first AI thing which we used actually in 2014-16 was to get all the data uh, into the EHR and enable one doctor to manage 10 to 12 OIC clinics. That means earlier the manual doctor used to go sit for 4 hours, 3 hours in one center, then again he has to move out to the next center, or he has to move to one more center and one more doctor is to come. So there are a lot of the doctors visiting. There's a time spending by the doctor, and even commercially for also for the corporate, like funding to the many doctors and having one virtual doctor and managing all the centers. It was something which we introduced called telehealth in corporate wellness, where it is got a huge success both in commercial as well as the clinically, where there is a lot of data we used to get it from the corporate, the patient basically who comes in a corporate, where we used to diagnose with the data the particular projects. For example, we always used to see the trends. Particular project, a lot of people showing BP is high, they're always any kind of stuff. Later, the input is given to their respective team, the manager, saying that the stress level we can see more in this project. That too much actually inside data, which is also we also done so much of the data trends and seeing also for particular building in a corporate center where there is issue with the AC filter kind of stuff, which is in turn giving some issues with the people getting cough, cold, and also headache. So with the data, with the clinical data, we can do multiple things which we are shown prone to the IT company that point in time, and they are also like that. So that's where we started using. Of course, earlier also AI was there, but not renamed as AI. Now with people now everyone talks about AI in healthcare. So with that, then with my 15 years, then later I actually come out and with my colleagues, with my all my ex-colleagues, we started my own startup called Medpass. So Medpass, I'll take 2 more minutes to explain what we do, and here also we cover what we are how we are using AI in our project, and what is the in terms of effect what we have done, what are the things we have used, what are the outcomes and all I talk about in our project. So basically, first we understand what is our product do, what is Medpass. See, Medpass is India's only health digital wallet app. It is a digital platform that supports consumer to save money on all the services under a single platform. That means if you just download an app and start using the app, you can save money on every transaction which you do across all healthcare services. That means where if you are using some pharmacy, you can save the money. If you're using in laboratory, you can save the money. If you're going to the hospital and started using in OPDs, IP cases, inpatients bill, then laboratory, home care services, doctor to door services, doctor on call services, even medical device health insurance, almost all the healthcare services you can access in only one platform. As of now, we are only player in India who are giving all the services under a single platform and ensuring that they get a quality healthcare as well as also save money during this time. Along with that, we also facilitate emergency medical loan where somebody is in a need of money in case they are not having money with them, they're short of money. We also facilitate emergency medical loan through our app. Okay. So, what we are trying to actually solve the problem is basically is enable to fund healthcare and access to quality healthcare. So, San India, as per the survey says, out of 65% in India are out of pocket. That means they are not prepared themselves for their health emergencies. Like taking insurance and all. Now it has increased, but insurance also its penetration is low. Only in cities you can see, but they are not prepared themselves for their health needs and also access to quality health. In case if you do not have money, the access to quality health care, it might become tough for them. So this is a major problem which we thought that we should solve it. See, when I used to work for companies, I used to go for an hospitals and for some data collection and kind of stuff. I always used to see the patients basically when they're making a payment, they should ask for a discount. So please give some discount, please more bill, I cannot wait. And otherwise, also other part I used to see people come and calling their relatives, friends, family members to support them with some funds for their emergency need. These are the two major problems. One is the discount part, other is was the emergency medical funding part. So to address this, so we have brought in, I had the thing in mind that we should solve this issue by bringing from the technology. That's why we, with my team, we all created Medpass. So that which will actually take care of these two segments. One is you don't to ask for discount, you pay through Medpass and you get a discount. Second thing is if you are in emergency where you can access to funds which comes in 48 hours. So this is a big market actually. I want to show this to all the students because since you are in healthcare, you should know. If required, you can take a snapshot of this and you can keep it with you. Basically, India is a very big market. The market value is very high. In fact, like 370 billion is the market value, and more than 900 million plus is more than that now. It's online users. And India being a third largest healthcare market in the globe, there's opportunities more, and also 80K plus hospital is there. So this is a huge market. Basically, the number shows it is a huge market, and anything you want to do in healthcare is also called as a evergreen industry also. In that anything you do it, if you get a proper traction and all, it is a good things to work on. So this is our journey so far. So we started from 2020 for Android user. We started with around 9 lakhs transaction. So over a period of time, now we could be able to process around 50 crores worth of transaction. And as a startup, we could be able to generate around 6.5 crores of revenue. And we are also happy to share you that almost around 3 crores money so far we have saved to our customers. So currently we have around 23,000 plus downloads, but we are covering almost 1 lakh families. We run our operation in Bangalore, Mumbai, Hyderabad, and Mysore. So I am raising my next round of funding probably in another 1 or 2 years. We'll try to reach 10 plus cities. So this is what we bring in as innovative app features. Basically, it's a health wallet. It's the difference between an app and it's a wallet app. What it does is it's a virtual money. It goes and sit to your wallet, and we allow them it only to use for your healthcare needs. So that's why it's called as a health digital funding, combined with quality affordable to create integrated health ecosystem, right? So we generally won't allow people to go use this money for shopping, other purposes, movie tickets, booking and all. This is our objective to save money for yourself, for your future, for your health. So all the money which you do, even if you're doing like 100 rupees transaction, you can save 10 rupees. If you are doing even 10 rupees transaction, you can save 1 rupee. In case if you're in hospital, if you're admitted in a hospital where you're paying around 2 lakhs, 3 lakhs of the big amount, where you can save up to 25,000. We have in records people saved more than 60,000, more than even 1 lakh. People who paid around 15, 20 lakhs through the wallet. So we also have the data with us. It's a huge benefited for our customers. You can also go and see in Play Store. We are like 4.95 out of 5 in the Play Store as well. This is all we do as a thing, ambulance services, discount and all the things that what we do. So now coming to these are our B2B connects. So what we do is one side we engage healthcare service providers, other side we engage the health users. So today, if you talk, so we work with all the top 10 hospitals in India, at least with the 4 cities we work. We work with Fortis Hospital, Manipal Group, Aster Group, then we work with other big hospitals. Sagar is there. So Shivan Shiva Orthopedic is there. We work with very branded hospitals, and also we work with medium and mid-sized hospitals. We work with labs. So we have auto integrated system in one place. Other side, we have customer. They come to platform, start using in any of our service providers, and start getting cashbacks basically. So now coming to point, the major thing, what we and how we use AI. And this is only till now, I only talking about what we did. And generally, you are in this sector, and most of the general things I thought I'll not be speaking. For example, so what is AI, what is ML, then what are the risks, all the stuff. This is the general things. I'm assuming that the data you guys have very well good knowledge on that. So mostly I'm talking so far is what have I done in my career and what we are using in as a part of AI. What is our future plan? Later we also talk about what is the perspective for students in this industry basically. Okay. So what we do is we have introduced divided, one is called basic AI and one is called advanced AI. The basic AI which we have built, which is already in the field was, so since we have the patient data with us, so we know that we have developed some trends. Basically, we have developed based on the data. So what it does is it sends the alert. For example, I have around 800 rupees in my wallet. I am not utilizing. So the system, the AI system, the engine will send an alert to the respective user saying that you have 800 rupees and these are all your nearby service providers and you can go and avail this service, right? For example, 799 is a full body checkup in Thyrocare. It sends a message saying that why you can avail this service. Anything which available, 299 having consultation with cardiologist, this hospital is available. So it sends alert. So this is what we are building. It is already in the field, which basically we sends the alerts to the users. Apart from that, it also reminds about their the monthly medicines. In every month, one it alerts them that this is a time for you to buy this. Similarly for lab test, in lab test, it goes to the next level saying that, for example, you are a diabetic and if you have to get it HbA1c done in 3 months, so it sends alert, is look at the data and also sends saying that this is 3 months, so you started getting into that. So not only just identifying the trends, which what we also try to build in advanced AI is to help our users with kind of some education called e-education or whatever you can call. So for example, these are personally videos which were with the help of doctors. We are doing it is still not live. Basically, what it does is, for example, I am a diabetic. So morning I get a alert with a video link, with basically the YouTube video link through our channel. Say that this is what system AI sends and say that use look into this data. The 3 to 5 minutes, basically giving tips on how you have to control your diabetes. What are the morning things you have to do? When you have to take a tablet. So what are the measures and all? It educates us. If you are a hypertension patient, so there is a different video links will be sent. If you are anything related with the eyes, this will be done. Anything you are some depression kind of stuff related video will go. So how our system identifies, we have inbuilt some algorithms, AI algorithms. It basically runs from the back end and identify the respective user, which is patient, and send the data to them. So we are like try to do around as many as videos, 3 to 5 minutes videos, which should help the users. So based on them, it is not a general video. Basically, we try to make a personalized video. That's what it makes difference for a particular based on the data which we have. Of course, the general videos also we have in our channel as well. So this is what we are trying to build in. So Also, there are two things we are trying to do in diagnostic part, which again we are working with a couple of labs and with the doctors to how we can be able to do it. So, for an example, if you go to diagnostic center and got your blood checkup done, right? Again in diagnostic there are two things. One is radiology, where is your scans and all comes. Other one is called a blood test, which is basically diagnostics the thing which you do for blood test. So in blood test, when you get a report, there are two things you get it generally. One is the reference ranges, and another one is what is your reading. And currently, most of the times we see today of course, in radiology, you will have some prediction it will be given, but in the blood test, we will not be seeing any report generated automatically, right? So we are trying to work with the doctors and also with our IT team to come up with AI-driven reports based on the reference range. For example, you are a diabetic or your HbA1c is more than 6.5 or 7, and AI will read all the readings. See, if you take one blood test, it comes up with multiple blood tests. For example, if you take 799, some test done, it covers on 60, 70 tests. In that, the many things will cover. Your complete blood count, you will be covering your the electrolytes, your HbC, LDC, your cholesterol level. So many things you will get it in this part of the report. But what we are trying to build the system is to look out the reference ranges, look out which is not in that range, which is has some issues, read the data and come up with some kind of a report and push that to a doctor. Doctor will look into the data, and in case if he can able to modify in that particular data, he will modify, and then you will give that data to them. So that we are trying to solve the timing issues. Today also, if you go to morning, you have to wait for till the evening. Of course, you have to run the machine. So many things are there, but the AI reports will try to definitely going to help the doctor. That is what we are keeping in mind, and reduces the time and effort as also. Of course, it will not replace the doctor as such, but at least for now, but it will definitely give some tentative data to read. So what doctor can be, though in Indians, for example, even though today if you do ECG, if a doctor says abnormal ECG in the machines, the doctor generally won't look into it. They look into the graphs and other stuff. But again, it is in the thing we try to develop something and see, we're going to see what will happen there. So same thing, we are trying to build something in health insurance part. So since we have data, today is insurance tech is one of the things, most of the top CEOs of the company, they talked about two, three things, which one of that is the core prospective in terms of business in next decade will going to be health insurance, which is called insurance tech. In that, so a lot of the research is going on that. So we as a Medpass try to do some kind of analytics and try to bring in AI and see what we can do. So we currently work with Care Insurance as our health insurance partner. So today, if you see healthcare products, which is basically given for the middle age and other stuff. So we try to see the data by the user, and instead of taking the general insurance which covers most, so we try to help them with health insurance companies to have a customized insurance. For example, is related only with diabetic, you may not have to. So just go for this one. In case again, it is up to the user whether you to go for this or not. But through the existing data and predicting future things, this AI will give the data saying that this product can be made for this particular user or particular patients. So that kind of data is possible only when you read the data and kind of there are many parameters come. So open form, I'm not be discussing what we are doing in deep thing and other stuff, but a lot of parameters we will go through. There is a separate team with us who we work on. We will work with the doctors and also work with the companies and figure out that customized insurance definitely is going to help in the future. So now prospective, we'll just talk about slide and more or less I'm done. So students, the moment there are two things we all, when we are grown up, there are two things told in our by parents. One is you learn yourself and look for a job. So the people, the most of the, at least 90% of the parents, and we generally won't tell our kids that why can't you become an entrepreneur? Start with entrepreneurship, because we all have that risk level, that whether we successful or not successful kind of, but even that approach, it's not there. But we can see from last 2 years, the people who come out of the colleges, now they're becoming entrepreneurs. See, entrepreneurship is also not easy, it's very tough, one of the tough, where whether you succeed not succeed, but initial ages, when you start your career, even if you fail 1 or 2 years, I'm sure that you will be learning many things. If you ask me as an entrepreneur, I suggest instead of searching for a job, you start for a startup. So how to do that? So first of all, if you have something, product, ideas, or anything in mind, start your POC, proof of concept. And while doing the proof of concept, please meet your people or guide, mentor in your college, and figure out and talk many people, meet around 100 people and ask for it, saying that is I'm trying to do, are you willing to pay for this service or this product or this solution or this AI? The people, even if you get 1 or 2 yes in out of 10 or 50, 4 or 5, then you should be validated, saying that people are willing to pay for this solution. The moment you feel that people are willing to pay for your solution, then where you start raise some funds with your family, friends, put up a company, whether it's a private limited or it's a LLM company, then you go for it. Then if everything goes well, then once you get initial traction, there are so many companies in India, you can raise funds for sure. If you believe that your product or services or anything you can fit in, definitely there's a lot of scope in India, especially startups, where the funds, there are a lot of funds available. There are a lot of accelerator program is going on. There are a lot of colleges running cohorts. Otherwise, there are the government of India doing so many incentives. There are so many. Only thing is you should know whom to contact and how to get the details. There are few companies I have just listed, so that it might help you guys with, so probably most of them you know. So one is Bayrak, is basically the company would basically help you with on biotechnology part, where there are a lot of funds available in case if you thing is, if your project is looks good, then I think they'll definitely come forward for investment. There is one more called CCAP, which is in Bangalore. There you can approach. They'll also help you with even for doing few 4 to 7 lakhs of money. You can definitely raise. Of course, it's not easy. You have to fill the form. You have to go and meet the people, spend some time. Startup India, definitely. Once you have traction, you can apply for it. There are other two private which I know personally, who does even investment on the ideas and other things. One is WHB Founder Circle, is one company where do, and Ramaya Evolute as a part of Ramaya Group, where we also funded. They also look into this idea stage companies as well. These are the few awards we received for our organization. So with that, I'll complete my session, and once again, looking forward for some questions.
Hello, sir. Good evening. This is Soumya here.
Hi, Sumya.
Sir, coming to the AI involving healthcare,
Yeah.
what are all the difficulties you faced while integrating AI into healthcare, sir?
So that's a good question. So see, generally healthcare, building healthcare in AI is one of the most difficulties, because which is we are going to directly affect the patients. Okay. So what we do is we bifurcate data into 3 stages: data one, data two, and data three. Right. And we also work with our clinical doctors to give an input also on the field. The difficulty is one of to, so to getting the exact data is the one difficulties you should always see. So for that you should collect more data, whether the data is sufficient, not sufficient, and collecting the data is important. Once you collect the data, you have to validate the data. So then you have to have a plan B and plan C in some data with you, so that you can always try to match that if data is right or wrong. After that, the third difficulty will be to prove and give the data to the algorithm, whether how it comes. Again, the developer, the people who are working, they should always in touch with the clinical person, on with also with the product manager when he's building it, right? So these are the at least the few difficulties which you have faced actually.
Thank you, sir. And also one more questions sir, so how do you make the people to believe that, okay, AI is all, I mean, AI with other industries would be they would take it but getting the AI into healthcare and making people believe that it is possible, it would have been a challenging for you.
Right. So with uh, good part with us is we have incentivizing our user on every transaction which it does. So the belief of us, they always know that anything I use for health pass, Medpass, which they will get a discount part into, right? So if anything, if a new alert brings in, which always benefit the customer. For example, I'm selling an alert saying that there is a nearby pharmacy or nearby service and you have around 600 rupees as a cashback and go and use it. So somehow, since we are like saving money for the customers, with us, we did not pay anything. They will definitely buy it. Anything in India which associate with the discount, people will willing to take it. Not a problem.
Yes, sir. Thank you, sir.
Thank you.
Hi, my name is Dr. Girish. I just wanted to know, I'm basically a medical doctor. I'm an MD. How, what are the opportunities for doctors like me to contribute to AI and ML in healthcare? And second thing is, what kind of knowledge with respect to coding and all that is required to contribute to the AI and ML in healthcare?
Thank you, doctor. Thanks for the question. Good question. See, one thing is to contribute in a company like that, definitely people will welcome for your contribution because in the market there's only few doctors come forward to support in terms of their clinical knowledge. It's not only just sharing the clinical knowledge and also involved in clinical trials. I think there's a huge opportunities is there. Definitely. At least with Medpass, definitely we can see. Offline, I can connect with you and explore more on this. That is one thing. And second thing is, second question I did not get, doctor. What is the second question?
Our second question was what kind of knowledge do we need to have?
Yeah.
Is there a requirement for a coding and programming knowledge for us
Not
to
really. No. Yeah, not really. See, there are engineers, specialized engineers, because when you use the set of data, which use multiple things, Python, people use some Python, some will use some other languages. Of course, doctor for learn to that languages going may not be thing, but the input, of course, if doctor is interested to learn and do it, it's always thing. Otherwise, is to sit with a developer and try to work with them and give the inputs that will be more sufficient. But in case if doctor himself is interested to learn this language and start doing, it's okay. But in 90% of the cases, people won't recommend to have this knowledge, but at least basic level it should have like that which the language is maybe fit for this particular AI to build. The basic knowledge should be enough.
Okay. Are there any such opportunities in Medpass?
I can definitely we can discuss in offline on this.
Yeah, thanks a lot.
Students from the MSc and BSc background. So, do we have any opportunities to work with the companies like Medpass?
Definitely, why not? There are a lot of opportunities available because a lot of companies looking for a clinical data specialist. I think there are a lot of opportunities available. Currently, with Medpass, we are looking for some interns on the in terms of the marketing part. Last week only we are closed with one of the college in, but there are a lot of options available. But I can help you with, say, I'm a part of many founders group, which is around 3,000 startups are there. You can reach out to me through Soumya. I can definitely try to help you for finding a job for you guys. No issues.
The projection that you showed of about $80 billion is quite fascinating. But is this reality on the ground, or what is it actually?
No, it is there because see, of course, I cannot take the numbers here. Doctor, see, even Manipal Group itself does 1,000 crores per month. Okay, I think just Manipal I'm talking about. Definitely, the numbers are there. May not be 100% accurate, but it's closure there. This market is huge. Yeah.
The potential is definitely there
Definitely,
for health tech.
For health tech is like very, very big opportunity. What you guys can do is if you have any queries related to things, so you can drop out an email at bharathish@mediimpact.com or support@mediimpact.com. Either someone from my team will definitely respond in that support email. They are looking for any, even for services related to healthcare services, if you need any help from our side, which we always help. So that is also there. And even for anyone looking for internship and all, you can drop your message in support@medi-impact.com. Definitely someone from my team will respond. And if it is, they can help, that definitely help not only in giving you healthcare services and also with a better discount, and also with the job opening is there, we can definitely help you guys. Thank you once again, and thanks everyone for taking your time and your story at Medpass today. Thanks everyone. Have a great evening.